Nursing Assistant Army Exam Date. Question 1. A client has difficulty adjusting to a new facility. The nurse aide should: Option A. Tell the client they will adjust. Option B. Allow the client to express their feelings. Option C. Leave the client alone to adjust. Option D. Call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 2. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A, 1 inch. Option B, at least 2 inches but no more than 2.4 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B. At least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow. 3 to 4 inches may cause injury. Question 3. The best way to communicate with an unresponsive client is to: Option A. Avoid talking to them since they can't hear. Option B. Speak to them as if they can hear and respond. Option C. Speak loudly near their ears. Option D. Only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 4. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 5. When a client dies, the nurse aide should: Option A. Leave the room immediately. Option B. Provide post-mortem care. Option C. Call the family. Option D. Remove all personal belongings. The correct answer is option B. Provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 6. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 7. When dressing a client with a weak right arm, the nurse aide should: Option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 8. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 9. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: option A, perform all care for the client. Option B, allow the client to do as much as possible independently. Option C, rush the client so they finish quickly. Option D, leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 10. The nurse aide enters a client's room and finds the client on the floor. The aide should: option A, pick up the client immediately. Option B, assess the client, call for help, and do not move the client. Option C, leave the room to get the nurse. Option D, document the fall and call the family. The correct answer is option B. Assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 11. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 12. A client who is confused becomes agitated. The nurse aide should: option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C. Use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 13. When providing oral care to an unconscious client, the nurse aide should: option A, brush the teeth vigorously. Option B, use a sponge-tipped swab moistened with mouthwash. Option C, place the client on their side and swab gently. Option D, skip oral care for unconscious clients. The correct answer is option C. Place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 14. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: option A, document the temperature. Option B, report it to the nurse immediately. Option C, give the client a cold bath. Option D, retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 15. A client with Alzheimer's disease gets upset because they cannot find their deceased spouse. The nurse aide should: option A, remind the client that their spouse is dead. Option B, gently redirect the conversation to a pleasant memory of the spouse. Option C, tell the client to stop worrying. Option D, call the nurse to explain the situation. The correct answer is option B. Gently redirect the conversation to a pleasant memory of the spouse. Redirecting to a pleasant memory validates the client's feelings while avoiding the distressing reality. Reminding them the spouse is dead may cause repeated grief. Dismissing their worry doesn't address the emotion. Question 16. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 17. When removing PPE, which item should be removed first? Option A, gloves. Option B, gown. Option C, mask. Option D, goggles. The correct answer is option A, gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 18. When providing care to a client with dementia, the nurse aide should: Option A, maintain a consistent routine. Option B, change the routine daily. Option C, avoid eye contact. Option D, speak quickly. The correct answer is option A, maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 19. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 20. Which position is best for taking a rectal temperature? Option A, Fowler's position. Option B, dorsal recumbent. Option C, Sims position. Option D, supine position. The correct answer is option C, Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 21. A client with a history of COPD should have a target SpO2 of: Option A, 100%. Option B, 94 to 98%. Option C, 88 to 92%. Option D, 85 to 88%. The correct answer is option C, 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%. Question 22. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B, use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 23. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 24. What should the nurse aide do first for a client who has fallen? Option A. Move the client to their bed. Option B. Assess for injury and call for help. Option C. Document the fall. Option D. Call the client's family. The correct answer is option B. Assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 25. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk.